Myself, Dr. Ashutosh Kumar. I am an intervention cardiologist cum electrophysiologist practicing in cardiology field for last 15 years. In common man's language, if you are having any coronary issues and the block has to be opened, we call as a interventional work. And if you are having any electrical problem needing arrhythmia treatment, we call it electrophysiology. So I do both the job, and if you want in a very common man language, I do the plumbing job, so that opening the coronaries, an electrical job or electrician job. So this is the briefing regarding myself. I did my MBBS from Sri Krishna Medical College, Muzaffarpur, it is in Bihar, and after that I did my MD from Banaras Hindu University, Banaras, and I did my DM from IPGMR Kolkata in 2009. And after that, I was in 2 medical colleges as in charge of cardiology in GSL Medical College, Rajahmundry, and Narayana Medical College, Nellore, for 2 years. After that, I pursued my electrophysiology at National Heart Institute, Kuala Lumpur, and I went to a lot of part of the country where the electrophysiological work and intervention work was going. It was in the Munich, Germany, and Milwaukee, Aurora Heart Center in Wisconsin City. So I was having a vast experience of both the intervention and as well as the electrophysiological work, and my area of interest is electrophysiology, because this is the domain of the cardiology where we are having curative treatment, while most of the part of the cardiology we are having only and only what you call control of the illness. So with this word, let me have some purview of today's discussion, that is regarding the coronary artery disease. So this is a pandemic, as we all know. There is a corona is a pandemic, but this is a non-infectious pandemic which is engulfing the whole globe, and we can say a lot of patients are having the coronary artery disease. But per se, what coronary artery disease is, we have to understand. So corona means the jewel or the crown of the heart. So the crown of the heart means heart is having its own circulation, and this circulation we can say we are having 2 coronary artery, right and left, and these coronary are on the heart of the patient. So that's why it is called corona. And as you know, heart is one of the autonomous organ which is having its own heart supply, nerve supply, electrical activity. So coronary means the coronary arteries are the nourishing artery which provide the circulation to the heart. Heart is the organ which works 375 days in a 365 in a year and 24 hours by 7 every day. So this is the thing, and you can understand how God has created this organ so efficient that till your death it is working hard, even when you are sleeping, when you are working hard, everything it takes care without getting any problem. Or if at all the problem is coming, it has its own robust system of repairing it. So coronary artery means any issues which is related to the coronary circulation, either it is getting blocked or it is having some impediment in the circulation. So coronary artery disease, per se there are 2 variants, what is called acute coronary syndrome, where all of a sudden the coronary has been blocked, and in that scenario we have to open the artery, we have to start some medicines, blood thinners, so that it should not impede over the time and the block should not happen. So this is the one part of the treatment that most of the people are knowing, and we are having 3 type of diseases even in the acute coronary syndrome, what we call as a unstable angina, non-ST elevation MI, and myocardial infarction. These are common cardiac emergencies, and when you are having a complaint of severe heaviness in the chest, or you are having chest pain which is radiating to the left arm or right arm, or sometimes giddiness or unusual weakness, feeling of doom that probably something is going to happen with you, immediately rush to the hospital, get the ECG done as early as possible, take a cardiac opinion, and probably, what I know, your ECG is enough to prove whether you are having cardiac emergency or not. ECG speaks loud when the circulation is coming as an issue, means coronary disease is happening or not. But in the initial stages, sometime the ECG may be not coming a very clear cut, or we can say diagnostic. In that scenario, we have to rely on some blood markers we call as a TROP-T, TROP-I and CPKMB. By doing those tests, we can get the clarity whether we are having myocardial infarction or it is a non-cardiac issue which we are coming. And whenever this type of complaint comes, certainly the treatment will be first the medical management, and if the coronary issues we are seeing on the ECG or in the echo or by the clinical purview that the blood pressure is fluctuating, chest pain is fluctuating, it is increasing, sometimes a lot of sweating is happening, there is a change in the vital parameters, then it is become very, very important to intervene early, and then the interventional cardiologist role starts. So heart is moving structure and they take care of everything in that scenario. So immediately doing the angiography, and as per the ECG we know that there may be some block, we clarify the block by doing the angiography, and wherever it is there, then and there we fix the block by putting the stent or by the opening the vessel by the balloon, and after that we give the blood thinner that it should not happen in the future or during the hospital stay. So this is the nutshell about the coronary artery disease. But there is some sets there is a second set of patient in which the patient is not in the cardiac emergency, we call as a stable coronary artery disease. So these type of patient are having on and off complaint, and the typical complaint that we all have to learn and we have to even share with our colleague or with our family member, and that complaint is chest heaviness which is coming on doing work, exertional work or emotional strain. Whenever it is happening, the patient will say, I am getting some heaviness, and the time I am moving, my complaint increases, and the time I am taking rest, I feel comfortable, or it may relieve totally. So if anything, by the emotional or the physical strain, if you are getting a heaviness and that relieves on the rest, we define as an angina. And if you are getting an anginal complaint, if this type of typical complaint is coming, you should always reach to your physician or a cardiologist, and certainly he will take care for you, because you need further evaluation in form of risk factors, and at the same time you will be getting some medicines which will relieve your complaint, and your quality of life will also improve over time. So regarding the coronary artery disease, the complaints are very clear. The patient will be getting some complaints like heaviness in the chest which is coming on exertion, either it is a physical or emotional. And whenever it is happening, they have to report to the doctor, and certainly there are some risk evaluation starting from lipid profile, thyroid profile, risk markers. The patient may be smoking or may be overweight, and those patient may be having diabetes that need to be controlled, and medicine has to be started. And most of the time, I can say 80 to 90% of the time, their complaint will be relieved if they are following the lifestyle modification which has been advised to the patient, and sticking to the medicine at the regular basis. If he is having hypertension, control it. If you are having dyslipidemia, control it. And at the same time, never and never neglect the importance of being active, physically active, doing the daily exercise, and the stress management. With this word, I just want to say that coronary artery disease is a pandemic, and it is still one of the most easily controlled illness. If you take out the fear from your mind and stick to your doctor advice, and wherever need, you just get intervention to make your life better. Thank you so much for viewing this video. I will come again with some more information related to this in my next video. Thank you so much.